Well, good morning, and thank you for joining us today. I'm Dr. Bruce Vanderhoff, Director of the Ohio Department of Health. Well, we've been saying that we were likely to see a very busy respiratory virus season this fall and winter. And it appears that that busy season is now underway, having started in October with a significant increase in RSV here in Ohio. This increase, while dramatic, has been in line with what we've seen across the nation. And while Ohio and much of the Midwest have not yet seen the waves of cases crest, it's encouraging to observe that some parts of the country, which rose the earliest, are in fact seeing RSV cases level off or even decrease. But RSV isn't our only concern. Unlike last year, a year in which we saw very little flu, we are also now witnessing a significant increase in influenza-related hospitalizations here in Ohio. As I've noted previously, the robust return of RSV and influenza as we enter our fall and winter is not entirely unexpected, given the similar pattern reported in the world's southern hemisphere, which just emerged from its winter. The result, though, of an early and dramatic spike in RSV and now an overlapping rise in influenza is high demands on our hospitals, and right now, most especially on our children's hospitals. Their emergency departments, urgent care centers, and primary care offices are all experiencing very high patient volumes. Now, this, of course, also leads to unusually long wait times for their patients. But there are a number of things all of us can do to help support our children's hospitals at this challenging time. And I'm pleased that we have with us this morning 3 guests on our call who can help describe what they're seeing and how we can help. But before we turn to them, I want to just briefly discuss a few symptoms of RSV to watch for, and also some prevention efforts that can hopefully help mitigate the pressure on our healthcare providers. RSV is spread through respiratory droplets and usually causes cold-like symptoms. These droplets can settle in the eyes, nose, or mouth of another person, but they may also settle on common household items, such as tables, doorknobs, and cell phones and tablets. As a result, you can get RSV by touching these surfaces, then touching your own eyes, nose, or mouth before you wash your hands. Now, most people with RSV really do not need to go to an emergency room, and most RSV infections resolve on their own in a week or two. There are some, though, who are at risk for more severe disease from RSV, including very young children, older adults with chronic medical conditions, and those whose immune systems are compromised. Now, parents of infants with RSV should be especially alert for certain signs and symptoms like decreased feeding or activity levels, fever, or wheezing. The most important step that parents can take to prevent the spread of RSV may also, in fact, be to keep their sick children home from childcare centers or from school. Next, we want to encourage concerned parents to contact their child's medical provider promptly, recognizing that the majority of patients can be cared for in the primary care setting, whether virtually or in person, or in an urgent care, rather than in an emergency room. Parents and caretakers, though, need to pay particularly close attention to babies because they can get into difficulty much more quickly and may require much more rapid response. You should seek emergency care for your baby if you notice unusually fast breathing, ribs pulling with each breath, or a bluish color of the lips or face. Also, a fever of 100.4 or higher in infants up to 3 months of age is a very significant concern. Unfortunately, at the moment, there is no vaccine for RSV. There have been recent encouraging results in clinical trials, but we simply do not yet have an approved vaccine available for this fall and winter respiratory season. Nevertheless, we do have vaccines for both influenza and COVID-19, and it remains very important for parents to get their children vaccinated. Indeed, sadly, we've already seen a few pediatric flu deaths here in the United States this fall, which reminds us that the flu can be deadly, that the flu is not something to be taken lightly and is certainly not just a cold. Now is the time to get the family vaccinated against flu, particularly with Thanksgiving just around the corner.